You just got your pregnancy test back and it's positive. Everything seems to be going so well, but a few weeks later, the full effects of morning sickness kick in. No one told you that morning sickness lasted all day. I'm Dr. Kobayashi, a board-certified OBGYN, and today we're learning all about how to cope with morning sickness.
Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggy Pals, your pregnancy, your way.
Welcome to Preggy Pals, broadcasting from the Birth Education Center of San Diego. Preggy Pals is your weekly online, on-the-go support group for expecting parents and those hoping to become pregnant. I'm your host, Annie Laird. Thanks to all of our loyal listeners who have joined the Preggy Pals Club. Our members get special episodes, bonus content after each new show, plus special giveaways and discounts. See our website for more information. Another way for you to stay connected is by downloading our free Preggy Pals app. And it's available on the Android, iTunes, and Windows marketplaces. Samantha, our producer, is going to tell us about the Virtual Panelist program now.
All right, thanks, Annie. So if you don't live in San Diego, but you'd like to be a panelist on our show, you can still participate through our Virtual Panelist program. Just like us on Facebook and follow us on Instagram using hashtag PreggyPals. We'll post questions throughout the week prior to our taping, and we'd love for you to comment so we can incorporate your thoughts into our episode. You can also submit your questions directly to our experts. Learn more about our VP program through the community section on our website, www.preggypals.com.
Great, thanks. Well, let's go around the studio and introduce all of our panelists. I'm Annie. I'm going to be 36 next week. I'm a government contractor during the week, and on the weekends, I tape Preggy Pals. I'm the host here. I have 3 little girls, almost 9-year-old, almost 2-year-old, and then my baby.
All right, I am Samantha. I'm the producer of Preggy Pals. I'm 22. I am a stay-at-home mom to my daughter Olivia. She's 19 months old. I do not currently have a due date. Olivia was a unplanned cesarean, and I'm hoping for a VBAC next time around.
Hey everyone, I'm Sunny. I am the owner of New Mommy Media, which produces Preggy Pals, Parent Savers, Twin Talks, and The Boob Group, which is our breastfeeding show. And I've got 4 little ones at home. I have 2 older boys. The oldest is 4, and I've got identical twin girls who are just over 6 months now. I had a vaginal birth with my firstborn, but I had some complications with that birth. And so my second son and my twins were a planned cesarean.
I'm Stephanie. I am 31 and a stay-at-home mom. I have 2 daughters, 2.5 and 9 months old. Both girls were born in the hospital. One was a C-section and my second was a VBAC.
Great. Well, today on Preggy Pals, occasionally we have news articles or app reviews, different things that we review. So this was a news article that both struck me and Samantha. We shared it over Facebook and said, oh, we got to cover this on the next Preggy Pals episode. So the title of the article is Mom in Coma Gives Birth and Breastfeeds Her Baby. So this is here in California, Melissa Carlton. She had what the doctors thought was a benign brain tumor. And so they were just going to wait until she gave birth to operate. Unfortunately for Melissa, she suffered a seizure, left her almost fully unconscious. She still hasn't regained consciousness, but she has given birth to a baby boy, and they put the baby skin to skin, and the baby is breastfeeding, even though she is still in a coma. She's able to open her eyes. They say that she's able to know that someone's in the room, but she's not able to respond beyond opening her eyes, which I think is just wild.
Did it say how? I mean, I'm assuming this was a cesarean.
I assume so.
I mean,
yeah.
You can't push if you're in a coma, right?
Yeah.
So,
well, I mean, I don't know. Would your body be able to push the baby out?
I don't know, Dr. Kobayashi. Any ideas on that?
I would assume it was a C-section as well.
Yeah, that's what I'm gonna say.
Yeah. Wow. I mean, that reminds me of like Kill Bill, you know?
Yeah.
Uma Thurman's character, you know? So
that's amazing. It's amazing
awesome.
that they can do that. And the breastfeeding thing, I mean, it's just a testament to all the things that your body can do without you fully even knowing what your body is doing. I think about that when I was pregnant. I was like, my body's creating an arm today. It's doing this, or whatever, a liver or something. And it's amazing that all can happen without you being cognizant of it. And this is just a reminder, I think, of that.
yeah. You say that, Sunny, and that reminds me of just the difference between I'm big into to breastfeed. I breastfed all my 3 girls with all different sorts of challenges that we've had to overcome. But in the end, at the end of the day, we were able to make it work. But the Leche League's big book that they have is The Womanly Art of Breastfeeding. And if you go to the previous edition, the one that I bought when my first daughter was born, it's like cradle and cross cradle and football, and like it's and you need of course you need a stool to put your feet on, and like all the stuff you need, and it's just made it so complicated. And the more recent edition, it's like lay back in about a 45-degree angle in the bed and put the baby between your breasts, and they will latch. And this is what a good latch. This is what a good latch generally looks like. But then, like, just keep the baby there.
Yeah.
That's it. I mean, they could have made this book about 200 less pages, but they didn't for some reason. But yeah, it's almost like a totally different book. But yeah, it makes me think of, you know what? It doesn't have to, breastfeeding does not have to be that hard.
Well, think about it.
If a woman in a coma does it.
I mean, what did we do before the book came out? I mean, we've been breastfeeding our kids for thousands and thousands of years.
Without the breastfeeding pillow.
Without a stool, right? I mean, it's amazing.
Yeah. Today we're going to be talking about how to cope with morning sickness. Joining us here in the studio today is Dr. Kobayashi. She's a board-certified OBGYN and the chairwoman of obstetrics at Sharp Chula Vista Medical Center. Welcome to Preggy Pals, Dr. Kobayashi. Thanks for joining us.
Thanks for having me.
So, obviously morning sickness, feeling nauseous. What causes that? What do we think causes that?
So morning sickness is a very common problem in pregnancy. The exact cause is actually unknown, but it does appear to be related to the rising levels of pregnancy-related hormones. And by that I mean HCG, estrogen, progesterone, and placental growth hormone. The hormonal theory is thought to be true because you typically see the symptoms get worse when HCG levels are very high during the pregnancy. Also, the more placental tissue you have means you can be a little bit at more of a risk for suffering from nausea and vomiting. So that would include people with multiples like twins and triplets, for example. And also, another interesting fact is those who are carrying a female fetus are a little bit more prone to morning sickness as well because female fetuses produce more HCG. So,
So there is some truth to that because you hear that as kind of a wives' tale.
Yes, you do.
And I didn't know there was some truth to that.
Yeah, I'd always heard that, and that was how with my second, I was convinced it was a boy. Mm-hmm. And I I've had the anatomy scan at like 19 weeks or whatever, but I told them not to tell me because I knew. Because I didn't have that much morning sickness. It was a boy, and so it was a little bit. It's kind of makes me look silly, here. This is Preggy Pals host 411 here. I look like a bit pretty silly because I just told them not to tell me, and then the sonographer was like, okay, and she didn't tell me, so I bought boy clothes. I did not pick out a girl name.
What?
Yes.
I didn't know you did that.
Yeah.
I didn't hear this story before.
It was Henry.
Well, it's a cute name.
It was a cute name. I was like, it's going to be Henry. I don't need to pick another girl name. Yeah, and then my grandmother was very, very old, just about to pass. And so my aunt asked her, well, what is it going to be? And she said, oh, girl. And it was because of the lack of morning sickness. The lack of morning sickness was the main thing. I'm like, no, I didn't hardly have any morning sickness, not like the first one, which was also a girl. Yeah, and then I pushed her out and, oh, it's a girl. I'm like, what?
No.
Well, the first thing I told the nurse was, I said, oh no, I only have boy clothes. Which I feel kind of bad about. Sorry, Lou. Sorry, Lucy. So
what are you going to do?
Exactly. Dr. Kobayashi, when does morning sickness normally start for most women?
It usually starts somewhere between about 5 to 9 weeks and then can continue on up until about 14 to 16 weeks. On average, it lasts about 35 days or so, and it rarely goes into the second trimester. Luckily, about 90% are over it by about 22 weeks.
Okay. Stephanie, you had 2 girls, and did you have experience with morning sickness? I mean, what was your experience?
Yeah, my first, I began feeling sick around week 7. And it only lasted through week 10.
Oh, nice.
And I really only threw up once, and it was right at the end of it.
I feel sometimes more that if you throw up, you actually feel better.
Satisfying in a strange way.
Well, like you feel better for a small period of time.
Yeah.
Yeah.
But then with my second, I think the day after I got the positive test, the world was rocking, and it didn't stop until about 15 weeks.
Oh. But it sounds like, Dr. Kobayashi, that's a pretty normal,
Absolutely.
Yeah, That because when you get the pregnancy test, you're probably like 4 or 5 weeks around
Yeah,
that time.
I test early. Like I get early positive. So
Yeah.
I was about probably 5 weeks when I started feeling a little nauseous, and then it just didn't stop until about 14, 15 weeks.
Did you only throw up once there?
I never threw up the second time.
Oh, okay.
But it was way more uncomfortable than the first.
Yeah. It's hard to live your life with
Yeah,
that
and I had a
going on.
toddler. So I was just laid up on the couch for
Hey, Dr. Kobayashi, I wonder about that. I mean, does exhaustion play into that? Does it make it worse?
Oh, absolutely.
Yeah. Well, see, maybe that
I
was
would
part
believe
of it too.
it. Yeah.
Yeah. And I noted with my second, it wasn't bad, but by then my firstborn was 6 years old. So she was in school. She was really self-sufficient. I'd be like, "Hey, Clara, go."
She could get you some saltines if you need.
Exactly. Yeah. Go get mommy a cracker.
Right.
But with my third, I was 7 months. My second born was 7 months old when I got pregnant, and so I was breastfeeding, and my
very
supply
exhausted.
tanked. I was exhausted, and the morning sickness was, like you said, it was terrible. I wasn't going to tell people at work, because it's just like when do you tell people?
Right.
Because I didn't want to tell everybody I was pregnant and then miscarry.
Right.
So there's that consideration. But I was so sick.
That you almost have to say something.
Well, that's eventually. I mean, I looked like the Grinch that stole Christmas. I was so green, and and my coworkers were just like, "What is going on?" And I'm like, "I'm pregnant. I'm sorry." I just, so that was good. They sent me home. So yeah, yeah. But I guess, I guess that's one thing that at least I always tried to say to myself, and I don't know if you other ladies and you said that to yourself as well. Of like, at least that means that it's a healthy baby. I don't know if that's true or not. Is it more incidence that if you have morning sickness, that it means the body is growing the baby?
But
And the baby's gonna
it
be
has
healthy?
to do with the levels of the hormones. So, it's a good sign.
Yeah. Well, I guess as a woman who's had a miscarriage before, it was like, well, you know what? When I had that miscarriage, I wasn't having all the pregnancy signs. And so I was like, well, maybe if I'm having these pregnancy signs, maybe this pregnancy is going to stick around. So, yeah. So it did in that case. So, well, Dr. Kobayashi, what percentage of pregnant women experience morning sickness?
Actually, the majority of pregnant women experience it, about 70 to 85%.
Oh, okay. Yeah. And what was Samantha? What was your experience with morning sickness? Did you have that when you were pregnant with Olivia?
I did. So it started around 6 weeks, and then I had it up until around 12 weeks. So I had it for full 6 weeks. I was fortunate enough that mine was in the afternoon, and because I was still going to college, all of my classes were in the morning.
Oh, nice.
So it worked out conveniently that I could get all of my classes done and everything, and then I could just lay on the couch the rest of the day. But I was in a similar situation like you, where at 6 weeks pregnant, I'm like, I'm not ready to tell people because there's still a danger zone. But then when it's I can't even go, or there were days where, I was sick in the morning and couldn't go to class, it doesn't look good to just not go to class. So there were a couple professors where I had to be listen, this is what's going on. I really don't feel well. And I was fortunate enough that they were all very understanding, and it worked out.
Mm-hmm. And that is hard when you're trying to attend. I was in post-grad school with my first.
Showing me up, Annie.
Yeah, exactly. Bachelor's degree. Oh, that's nice. Your bachelor's. No, but that's tough when you're sitting in class and you're not feeling well,
Yeah,
to
and
try
it's
and learn something new.
Yes, hard.
Yeah. I had a calculus class that I had first thing at 8:00 in the morning.
Oh, you got to be kidding me.
And it was and feeling nauseous and just
I think calculus would make me nauseous.
Yeah, I was going to say, are you sure it was the pregnancy?
Yeah. Dr. Kobayashi, what are some common triggers of nausea that moms experience? What are some things that tip moms off?
Of course, it's different for everybody, but it could be a number of things. Stuffy rooms or odors like perfume, coffee, food, smoke, even heat and humidity, noise, visual or physical motion like flickering lights or driving around, excessive exercise, being tired, food with a lot of sugar and spicy foods, and also high-fat foods.
Oh.
Or calculus class in your case.
Calculus class, yeah. Sunny, what set you off?
Oh, I felt mine just happened regardless of whatever I was doing. I don't really feel like there was too much that triggered it. I did have food aversions, and that would just not make me feel good. But I think that's a little bit different than just having morning sickness. And for the most part, my morning sickness was in the morning primarily. It's mid-morning, not right when I got up, but a 10 o'clock kind of thing. I was actually telling these girls before the episode started that my morning sickness was easier with my twins than it was with my single babies. So I know that a lot of people, that's one of the symptoms they look for. Am I pregnant with twins because my morning sickness is so bad? But for me, and now keep in mind, my single babies were boys and my twins were girls. I don't, it doesn't really make any sense compared to what we said earlier, right? You would think I would be like double whammy.
Yeah.
But it just worked out for me. And then as far as when it started, I think I would have at least had my first prenatal appointment before it really hit me. And then all the way up pretty much through the end of the first trimester. But then it was gone. And man, was I glad when that was gone.
Yeah.
You know?
That's why what the glow is in the second trimester is it's
It's the happiness of no morning
I'm not
sickness.
morning sick anymore. This is fantastic. For me, it was pork, and it was awful because pretty much every week I would go to the store and I would buy a pork tenderloin and we would grill it with herbs and all that, and any herb, it didn't matter what it was. I could, like raw pork, I couldn't handle it anymore, which was sad, because it's like, wow, this is actually something that's pretty healthy for me, like grilled, the other white meat, all that. This is something good I could have for my baby, but I can't stand the smell of it right now. So
I actually never threw up as a result of morning sickness, though. It was just kind of that all over, like, I just want to lay on a bed and just lay there. But I never threw up. Prenatal vitamins forced me to throw up, and not.
Oh yeah, I had to start taking the gummies that don't have any
Me
iron.
too.
Because I was.
Is it the iron that does that?
Yeah, I'm the
the
same way
iron.
with just general multivitamins in general. I can't because of the iron, so
Yeah,
I take gummies.
I think that's me
but when I
too.
was pregnant, it was even worse.
I took them at night.
Yeah.
Just because I always heard
Oh,
if
that's
you
a
take
good
them
tip.
at night, then
Yeah.
you
Sleep through
sleep
it.
through some of the
If
nausea
you're
it can
sleeping
cause.
when you're pregnant, that's the other thing. I'd wake up in an hour and have to throw up because I was up, and then I took the vitamins and.
If I could fall
whatever.
asleep before the nausea hit in, then I could sleep through it.
There you go.
Well, when we come back, we're going to be discussing some different things that you can do to alleviate the nausea associated with morning sickness. We'll be right back. Welcome back. Today we're discussing how to cope with morning sickness. Dr. Kobayashi is our expert. Now, Doctor, everybody is supposed to be taking their prenatal vitamins. And before the break, we talked a little bit how some types of prenatal vitamins, women have to take a gummy one instead of a regular one. But is there anything in those prenatal vitamins that can help combat morning sickness?
Absolutely. Vitamin B6 can be very helpful with morning sickness, and also vitamin B12. It helps a lot with the vomiting. And also, if you want to, you can kind of get a vitamin, as we were talking about, that doesn't have iron in it. It seems to be very upsetting to the stomach.
Yeah, it generally constipates, right?
That as well.
Yeah.
Well, and that's tough because I what's the term when you're low on? I'm always anemic, severe anemic. Like when I was pregnant with the twins, I had to take 2 of those iron pills a day. Ugh. Yeah, and but that didn't
Chased
seem to
by a
have,
stool softener.
Yeah, right.
Exactly.
No, but it was
Go
like
ahead.
special organic whatever, and it actually didn't have that effect on me.
Yeah.
But that's so I still had
Floor,
to take
yeah. I think I know what you're talking about. Was it a pill or was it
No,
like
they were
a...
pills. They were like little baby iron pills.
Yeah, there are
okay.
different kinds that you can
Yeah.
take. Some are a little bit less irritating
Right.
to the stomach. So
Oh, okay. Are there any kind of foods that would help with nausea?
Definitely. I recommend eating a lot of bland foods like chicken soup or broths, plain baked potato. Sometimes people like to eat cold foods like sandwiches or vegetables or fruits. Whatever you can eat. I just would recommend keeping the meal small, but eat as frequently as you need.
As you mentioned, big high fatty foods and
Right, don't
spicy
eat anything
foods,
too
yeah.
heavy. It happens usually tends to be more upsetting to people's stomachs. So
Yeah.
and don't get too full. Don't stuff yourself at the buffet or
Right.
something.
Yeah.
Just because the more full you are, the more likely you are to vomit.
Well, and I've heard that before. Is instead of having 3 big meals, just eating small meals throughout
Exactly.
the day, and sometimes that can help a little bit. Which I guess is the first one being having the crackers right by your bed.
Exactly,
Yeah, so
exactly.
that you eat one before you even get up. So
I definitely
yeah.
recommend keeping some bottled water, a couple of snacks, some dry cereal, crackers, something just to put in your mouth and eat a little bit before you wake up and move on with your day. So
What's up with ginger? Ginger is supposed to be good for.
it does help with nausea.
Yeah.
So eating like ginger snacks or ginger ale can certainly help.
I was always fed ginger cookies, so ginger snap cookies. Oh,
Yeah,
I'm eating this because it helps with my nausea. Yeah.
Otherwise, it's really, really strong. I don't know if you guys have ever like had
Ginger
dried ginger or something like that. Like
Yes.
Trader Joe's sells that, and I got some thinking, oh, this is gonna help me with my morning sickness. But,
Spicy.
the moment I took a bite of it, I'm like,
very
oh,
good.
that's
You
gonna
don't-
make me throw up.
You don't take a bite of just ginger.
Yeah.
Yeah.
Well, I didn't. It wasn't like I was gnawing on a thing of ginger. But
They're ginger chews.
ginger chews. That's what they were. But they're still really, really strong.
They're very
Yeah.
strong.
Yeah. What about motion sickness over-the-counter drugs? I'm trying to think of like a Dramamine. Would something like that be effective?
Absolutely, that's very safe too. So,
Oh, okay, great.
Dramamine, Benadryl, antihistamines. The antihistamine doxylamine is actually used a lot in combination with B6
Oh, okay.
to help fight nausea, and it's actually found in the sleep aid called Unisom, which is over the counter. So.
Oh, okay. Yeah, I mean, whenever I go on a boat, I guess, that's kind of crazy. I was in the Navy
I know.
and I get morning sickness. Or I get motion sickness.
There's a joke in there.
Yeah, but I always found Dramamine or whatever the knockoff generic brand.
Yeah.
I didn't necessarily need to be Dramamine, but I always found that very effective. So that's good to hear that it's safe though, because I think pregnant moms kind of wonder, oh, gosh, what am I putting into my body, and everything that you put in your mouth gets to baby. Drugs or food or any of that. So, yeah. Have you found your clients that have used like acupressure, like C-bands? Is that effective or not really?
Oh, sure, it can be effective, and they're certainly worth a try.
Yeah.
At least there aren't any harmful side effects. So,
Right.
Anything that can help, I would recommend trying. Even things to reduce stress, like yoga, anything like that.
Oh, okay.
What are the C-bands? Yeah, tell me more about this.
Well,
They're
it's
just little
basically
bands.
it looks like kind of like you're back in the 80s with Jane Fonda, It's
like jelly bracelets.
No, like they're like sweatbands.
Oh,
Yeah,
like
yeah.
thick, like cloth material.
Yeah, like cloth material, and it goes and then
Oh.
and it has a little like plastic like bead on it.
Yeah,
kind of.
like-
yeah. It's
pressure.
it's around it, and then you have to place it on. So you put it on like you're in the 80s again, and then you have to place it. And I think that was my problem was I didn't have it on the acupressure point. I didn't have the right point. I'm like, these things are crap.
Yeah, it
So
didn't work for
sick.
me, but I think it was user error.
Yeah, but that's all it is. It's just
You just wear it all the time.
You just wear it all the time. Yeah, and it kind of gets sore if you have it in the right place.
Well, I didn't.
Well, there you go.
So you weren't
There
sore.
we go. Yeah. Yeah. So, Dr. Kobayashi, what are the typical drugs that are prescribed by a doctor for severe morning sickness?
We typically use medications like Phenergan, which is another form of an antihistamine. It works very well for morning sickness and also it's commonly used to treat motion sickness as well in non-pregnant people. Reglan is another good medication. It actually speeds up the emptying of your stomach, so it kind of speeds up your digestive system and helps
So it's
it
not
work.
sitting there. Yeah.
Exactly, and with the hormones in pregnancy, your whole system is it's slowed, so you're constipated, you get heartburn, and you have nausea and vomiting, so it helps with that. And there's also Zofran, which is a very effective medication. We commonly use that, and it's very, very good. And it also is used for people who are undergoing chemotherapy, so it's a very effective medication.
Well, yeah, that's some severe sickness right
Exactly.
there. Yeah. Did any of you need like not over the counter, but like prescription drugs?
I had both the Phenergan and the Zofran.
and that was with your second
with my
daughter.
second.
Yeah.
She just prescribed both and said try, because the Phenergan can make you sleepy.
It can make you very
So
sleepy.
she was like, this might help with nighttime, and then...
Oh, there you go. Well, but you had to take care of a toddler during the day, so that doesn't work for being
and
drowsy.
Zofran, some women respond really beautifully to it, and I don't typically have sensitivities, but I responded poorly to it, and I only probably took 3, and I had horrible constipation, like debilitating for a few days. So I kind of had to weigh nausea versus that. And I got off of it, but then I know so many other women who really benefit from it. So I think it's just kind of however your system works.
Well, it's definitely worth having that open and honest communication with your care provider and saying, look, these are the, you got finding the right thing, finding the right fit,
Right.
of saying, hey, here's the side effects that I'm having, and working and finding, because nobody should have to just suffer through morning sickness.
Right.
So maybe obviously if you can do it without drugs or just do it by just spacing your meals closer together, eating less, that's good. But
Exactly. Different
Yeah.
things work for different people.
Definitely.
So.
Yeah, great. Well, thanks, Dr. Kobayashi, for joining us today. For more information about Dr. Kobayashi and her OBGYN practice, as well as information about any of our panelists, visit the episode page on our website. This conversation continues for members of our Preggy Pals Club. After the show, Dr. Kobayashi is going to be discussing with us a more severe form of morning sickness, hyperemesis gravidarum. To join our club, visit our website, www.preggypals.com. We've got a pregnancy oops story here. Erin from North Carolina writes, I went to the hospital last night because I thought my water had broken. Earlier in the day, my husband and I had had sex, and I felt 2 gushes of water, and it ran all the way down to my legs to my ankles. I figured it was sperm, but it was a lot. Being a worrier and a first-time mom, we went to labor and delivery. They monitored me, checked my cervix, took a culture, all to come back in and say, it was just a lot of sperm. I was so embarrassed, but I think the hubby was a bit proud. I was worried, so I'm glad we made sure, but it will make for a funny story down the road. If you've got your own pregnancy oops story, go to our Facebook page or call in at 619-866-4775. That wraps up our show for today. We appreciate you listening to Preggy Pals. Don't forget to check out our sister shows Parent Savers for parents with newborns, infants, and toddlers, Twin Talks for parents of multiples, and our show The Boob Group for moms who breastfeed their babies. Next week, we'll be discussing stretch marks. Why do women get them, and what can you do to reduce their appearance? This is Preggy Pals, your pregnancy, your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
New Mommy Media is expanding our lineup of shows for new and expecting parents. If you have an idea for a new series, or if you're a business or organization interested in joining our network of shows through a co-branded podcast, visit newmommymedia.com. Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.